Hello and welcome back from your break. I am the moderator for your next session. My name is Anne McElvoy. I'm senior editor at The Economist, speaking to you virtually from London today. And I also lead Economist Radio. So I run all of our podcasts and audio, which we very much hope we can pique your interest for as we go along. But my job today is really to introduce, I think, one of the most fascinating subjects of our time. It is, of course, the very disturbing subject of the pandemic of COVID-19, but it is the question of what we've learned from it so far, where we think that it is changing the way that we live and questioning our responses to it, and how we might come out of it, and how might we come out of the recovery in better shape, perhaps even, than we went into it. As you know, because I think you're quite expert here at the Greenwich Economic Forum about the role of the audience, please be as involved as you can. We love that, and we'd love you to send in any questions. I have a Google Doc open to take Q&A and to throw them to my eminent guests. And let me tell you who they are, although I have a feeling that my first guest certainly won't need any introduction when you see her face. It's Indra Nooyi, former Chief Executive Officer for PepsiCo from 2006 to 2018, also chairman of its board of directors. She's blazed a trail for women in business, and she has made very radical changes, I think, along the way in the industry she's in. So I'm very interested to hear Indra's take about how we learn resilience and what changes we should make out of the pandemic. These days, she is on the board of directors at Amazon, and possibly even more importantly, depending on your priorities, she is a board member at the International Cricket Council. With Indra is Albert, and metaphors at your discretion, depending on whether the audience is as up on cricket as a few Brits around me here in London. And with Indra is Albert Coe, Dr. Albert Coe, from the Department of Epidemiology of Microbial Diseases at Yale School of Public Health, an eminent professor, of course. And COVID-19, I think, Dr. Coe, playing to your strengths there in terms of multifaceted challenges. I know that you've done some extraordinary work in the past looking at controlling disease spread given urbanization and given the challenges of social inequality. So I'm interested to talk to you about where COVID interfaces with that. And I should say, of course, that both of you are acting as co-chairs as on Reopen Connecticut Advisory Group, advising the state on its COVID-19 prevention and control plan. So that seems a good place to start. Indra, I mean, what have you learned from that process? And broadly speaking, tell us straight, how well do you think you are doing in terms of control and reopening plans?
Well, first of all, thank you for having me on this Greenwich Economic Forum. And I must say the highlight of working on Reopen Connecticut was getting to know Albert Coe and getting sort of a window into public health. Because as a business leader, you don't really think about public health as much as we should. And Albert Coe was a great teacher, taught me a lot about public health. And the first building block of anybody wanting to work on Reopen Connecticut is to understand COVID, understand public health. You've got to zoom in and become an expert to the extent you can on the problem you're trying to face. I will tell you that Connecticut did very well coming out of COVID. When we started to reopen the state, we did very well. We were among the top two states in terms of suppressing COVID. And we have very responsible citizens in Connecticut. People wear masks, they socially distance, and they follow the rules for reopening. Unfortunately, in phase two, we are having our share of cases. And Albert is still involved with the state, and Albert can tell you a lot more. But I'd say that overall, Connecticut is doing well. I wish we could have had this forum in person in Connecticut, but maybe next year. But Albert, you might want to give your update on how Connecticut is doing in terms of COVID.
Yeah, please do, Dr. Coe, and anything that arises, given that our time is a bit short, just to go around the world, just what arises from it and from the experience you've had. So we talked there briefly about a second phase. So we should be learning something, but what?
Yeah, so I think, and this is a lesson that unfortunately we're learning repeatedly, through the since the beginning in December, January of this past year. This is a highly transmissible disease. The threat of resurgence is always ever present, especially in the context of high social contact. We've seen this playing out in Europe with its resurgence. We here in the United States are having not only spread of COVID throughout the United States in different places in different times, but also resurgences. And that's what's happening here in the Northeast, and particularly in our state in Connecticut. And I think the bottom line really goes back to the kind of the foundational principles that Indra and the Reopen Connecticut Committee, I had the privilege of serving with Indra on that committee, is really the calibration between, as a calibration of outcomes, whether the desired public health outcomes, economic outcomes, education, and community social outcomes, and really that fine tuning that needs to be done in order to maximize public health benefit, but also the livelihoods of our populations. And that's been the tricky part that all of us are trying to learn and relearn as the pandemic evolves.
Indra, there's a lot of talk about a big reset, and you come out of the top tier of global capitalism as you've made your career there. You're looking around all the time at how businesses and the big corporates are responding to the pandemic. I guess at first there was a shoulder to the wheel feeling. Lots of money was being spent. There was a sense that perhaps this was a chance to reset the relationship. We seem to have also had an election in the US that plays to that feeling. Am I being a bit the economist, a bit of an uber skeptic if I say, do you think this is for real, or do you think this is something that when we look back we'll say that was just a response to a particularly difficult year?
Well, I tell you, what the pandemic has uncovered for us is all the fault lines in our society. They existed. The pandemic just made them a lot more visible and made them really come to life for all of us. And I think we have to sit back and say, what are the problems in our society and who's going to address it? I don't think we can pass those problems on to governments and expect them to address them all going forward, because governments are cash strapped. Governments, rotate every four years, and so there isn't any longevity in leadership. And I think the problems are way beyond just government, because in many ways, companies create some of the problems. And so I think whether it's climate change, income inequality, the quality of food that we put out in the marketplace, health insurance and who's covered and who's not, every one of these issues requires a dialogue between private enterprise and government. So private enterprise cannot be successful. So I think the time has come to stop talking about private enterprise being a force for making a lot of money and then let government take care of all the rest. Yet we fight paying taxes to government. I don't want to pay too many taxes too. Don't get me wrong. I'm an ultimate capitalist. But I also want society to succeed and thrive. So I think the time has come for this grand dialogue, for us to sit down and start with the problem and work backwards, as opposed to starting with, I'm here to make the maximum money, maximize shareholder value. Government should take care of all the rest. And incidentally, I will constantly trash government because government is inefficient, government is too big. The problems are too big. At some point, we have to address them.
Dr. Ko, something that sits right at this intersection is the great sort of hopeful story of this week is the potential for a working vaccine in the non too distant future, because of course to make that happen, it not only needs to work, and you can tell us more about that perhaps, but it also needs to be got to the right people, which is your other expertise, which is the distribution of social goods when it comes to public health. First of all, are you very optimistic about the announcement this week from Pfizer, and where does it leave that kind of challenge that Indra has just pointed up, that the distribution of opportunity, if you like, the distribution of hope?
Yes, so I think first of all, I think we're all excited about the preliminary results that came out of the Pfizer trial. They are remarkable on several fronts. One is that this is an entirely new pathogen, and to be successful on the first try is truly a feat. And the second of all, this is a completely different technology that was been used to make a vaccine, this mRNA vaccine. And so for these two things to work on the first try is certainly exciting. It's still preliminary. We're waiting for results, but I think all of us have high expectations for not only this vaccine, but other vaccines that also down the line may be more easily implementable. I think we have to understand that this is just the first step of a long road, and that we have to lay the tracks down for all the other steps, which may be even bigger challenges than actually developing and identifying a safe and effective vaccine. And these are three complicated processes that are going to have to be coordinated. One is, producing it at scale, for demand of the world's population. The second is delivering and storing these vaccines and delivering them to where they're needed. And as you know, with the Pfizer vaccine, this requires completely different technology. It requires keeping vaccines at -70-degree freezers, and that's an infrastructure that we currently don't have around the world. That needs to be ramped up quickly. And I think probably the most important part is that we have to deliver these vaccines. We have to get them to the people who need it most in an equitable manner, so that we can maximize the public health benefits. And many countries, including the United States, do not have robust mass vaccination campaigns. Actually, paradoxically, places like India, Brazil, many others have that type of infrastructure to get out a vaccine. The Pfizer vaccine will need 2 doses, one spaced 3 weeks, 4 weeks apart. How do you get that vaccine out to everybody and effectively and with large coverage rates? Those are the big issues.
And if I were just to Sorry, just to interrupt you briefly, but if I were to say the question certainly around my dinner table last night was, when does this change my life? If there is a back to normal, and I think Indra's already raised a couple of questions about what that might look like, so we'll come back to that. But is it in a year's time? Do you think our position will be very different? Do you think we might, for instance, be meeting in person? Dr.
No,
Ko, I'll let you answer that and then come back to Indra.
Yeah, Indra, would you like to take the first crack at that?
No, you should take this, Albert. It's your medical opinion that matters here.
So first of all, what we know about the biology and the epidemiology of the virus, the SARS-CoV-2 virus, this is going to be with us. This is going to turn from an epidemic disease to an endemic disease, just because of the high transmissibility. The second of all, it's going to take a while to get all those steps that I had mentioned in place to vaccinate people. And if we leave anybody behind, if there are any holes in that, we know that this is a vaccine that doesn't obey any borders, that with human movement and travel can spread quickly. So this is we're back to normal is not going to happen in the near future, and it's going to require robust public health and global responses.
Indra, we started to talk about how the role of corporate life might change, and the balance with political leadership still very much in the balance in the US as we meet virtually today. But if I were to say to you, look, you said you didn't want to pay any more tax than you had to, neither do the corporates. And it does turn out that we have, on one hand, a slightly more of a kind of moral tone, or perhaps an understanding that we're in a bit of a moral maze here, coming from big companies, and you've worked with it at least 2, and I'm sure a lot more in your career. At the same time, we have that kind of reluctance, shall we say, to pay the tax dollars by big companies, retail companies, tech retail companies come in for a lot of criticism on that. Is there a danger of kind of doublespeak here as we're looking at the particular challenges and the need to help the public realm?
I honestly believe, as I said earlier, Anne, we ought to start with the problem and say, what is it going to take to solve the problem? I don't think we can afford to sweep the problem under the rug anymore. Because, we always say climate change, we'll address it when it comes and it impacts us. We won't address it now. When the climate change issues start to impact society, it's going to be too late. When the proof comes, it's going to be too late. Similarly, with inequality in society, when there is a backlash from income inequality, it's going to be too late to address it. So I think history has told us what the consequences are if we don't address these issues. So I think as thinking people, we have to sit down and say, we know what the issues are. What do we need to do as companies, governments, communities, society? What do we need to do to come together to address these issues? We have to do it now. Then we have to figure out who's going to pay for it. I don't think this is about tech
Exactly.
companies or
Isn't that
mainstream
the squeeze
companies or
point?
government. It's all of us coming together and saying the consequences of not addressing these issues are severe. Let's not kick the can down the road. This is not an election issue at all. It's not any country's election issue. It's a long term societal issue that requires us to address it for an intergenerational answer. I just feel like, especially as a boomer myself, and I look at my children and potentially their children, I feel like we should have an intergenerational responsibility to put in place some of this infrastructure so that we just don't kick the can down the road.
So, but what question that's come in, and by the way, just to prime the pump, as we say, economics. Any more questions? You're very, very welcome. We have a skinny 10 minutes, and even that's an exaggeration. So please don't hold back. Don't be shy. These two can take on the most difficult questions in the world. Not a problem. One that I think perhaps goes to you, Dr. Coase. How do you suggest educating the next generation for the health hazards of pandemics and the need for better national public health policies? Wow, that's quite a big ask in a 3-line question, but off you go.
All right, so I think it really goes back to what Indra said before, is that this pandemic is exposed the fault lines. And what were those fault lines that we've said? So first of all, we've had structural, infrastructural deficiencies in not only our pandemic response globally and nationally, but also the lack of investment in public health in the last 20 years. This wasn't a problem that was just created in the last 6 or 10 months, but this has been a long-standing problem, whether it's weakening responses, weakening surveillance and monitoring systems. The second part is that when we're thinking about this issue of equity, and I think that's the key issue that's come out of this pandemic, is how it's exposed the fault lines across issues of equity and social justice. And we see in the United States the largest, the large burden that this has had on our underserved communities, on our Black and Latino populations. That is, part of that reason is the social determinants of health, the poor health qualities and status in the system of this population as they've experienced COVID. Those require long-term investments by governments, and it requires also global investments in strengthening multilateral rather than fragmented national or state or provincial responses.
Let me add to what Albert said. I actually think it's systems thinking, and I think that business schools, schools of public health, schools of medicine all have to come together and think about how we're going to address global pandemics. I don't think we can afford to be siloed anymore. Everything requires a systems thinking on how do we change society. I'll give you a simple example quickly. We keep asking people to wash their hands constantly. In many countries, there's no clean water to wash your hands. What are we talking about? It's going to keep spreading. So we have to think about how do we bring water to those communities? What's the supply chain to bring water to those communities? How do you bring disinfectant to their hands? So everything has got to be thought through end to end in a systems way. And I think it requires business schools, public policy schools, sociology schools, schools of medicine, all to sit down and talk about it.
Indra, just while you're on, can I just press you on something I was just very interested in that has come up, I think, a couple of times in your deliberations today. And this is the sense that perhaps corporates were not as good, or businesses not as good at some of the basics. This is before we get to more adventurous stuff, as they thought they were. And I'm thinking here about global supply chains, which a lot of us have taken for granted. And we almost, whether we boasted about it or regretted it, boasted of globalization, hyper-globalization, only to find out that supply chains have turned out to be less than robust. What do you learn from that as someone with such long C-suite experience about what needs to change?
I actually think the supply chains are fantastic for a different time, from a low-cost perspective, from being able to serve a global network. Companies did great on supply chains. But supply chains for national security, supply chains to save lives is totally different than supply chains for low cost and capitalistic environments. And I think what we're talking about here is what kind of supply chains does a country need to strategically control to save lives or for crisis management? What kinds of crises can happen? And what kind of inputs do we need to make sure we address crises? In this case, it's a pandemic, whether it's antibiotics, PPE, reagents, strips. what is really needed to have as inputs for a pandemic management. And I think that's slightly different than corporates and controlling their supply chains. So I think we have to come back to pandemic management. The last one was 1918, 102 years ago. We have to create the new book, and we have to think about how we're going to put some supply chains down to anticipate the next pandemic, because we cannot afford another pandemic managed the way we did, only because we didn't have a book, for no other reason.
And are there other things that you feel that you've learned from this as well? It might follow on from that point about what we were able to respond to well and what we weren't. If we're talking about the UK, where I am sitting, I mean, just the apparently, obviously not so simple task of getting a hold of enough PPE in time and getting it to the right places has shone a light, I suppose, on things which a lot of us had rather lazily assumed would kind of just work and just didn't when we hit this really very serious challenge. So I wondered, from knowing an awful lot more than most of us about this, what you've learned.
Well, I tell you several things. One is, the supply chains didn't work as well as they should. We had to compete with each other, so the prices went up. There's no question about that. The one that perhaps sort of rankled me the most was the search for a low-cost test. Tests, a PCR test, which is the highest sensitivity and specificity, still costs anywhere from $40 to $80, and sometimes people charge $150, $200. I think what we need is a $3 to $5 test with a quick turnaround, decentralized, with high specificity and sensitivity. But very few people wanted to focus on that because they wanted to get a return on their investments in the high-cost tests. Because once a vaccine comes, they think a test is not needed. So I think this is where your money-making mindset was at odds with what's needed for humanity.
And are you saying there should have been greater intervention to stop people making that kind of profit?
Not intervention, more focus on developing a low-cost test. So if the same brains that worked on the RT-PCR test and charged the high cost also went off and worked on a low-cost test, I think we would have had multiple bets, because nobody's going to afford a $70 test unless you can, come from a developed market and you're wealthy. And so I think these kinds of things, we have to rethink it.
Forgive me for rushing you along a bit. The clock is not our friend, Dr. Kai. I feel I should let you have your say on that. If we can make it fairly brief, because I'd love a closing question from each of you.
Okay, no, I think just to reinforce what Indra said, I think the two things that come to my mind is, one is that we really need a systematic way, and I know Indra is pushing for this, a commission to really understand what is right and wrong. We have a lot of our own personal ideas and inputs, but a systematic process of learning what went right and what went wrong. I think the other thing that, what comes out to me, what we've learned is that there's no silver bullets or magic bullets for this disease.
Mm-hmm.
We're hoping that we're hoping that vertical vaccines will be, but I think what we're learning is that we need multiple interventions, multiple a systems approach, and at the crux of that is behavior and behavior change, and that's something that we haven't gotten right, at this moment. And
you really mean about prevention when you say behavior change?
Behavior change, well, face mask, use of face masks, use of respiratory and hand hygiene, social distancing, using that lever, and that's, I think, at the crux of really why we're having these resurgences, and we need responses in terms of that.
I'm nearly out of time, and they do shoot the moderator if we go over. It's a very ruthless operation, the Greenwich Economic Forum. We live in fear of the big hook coming to get me off stage. But very brief thoughts, if you could. What do I do as an individual at this time, says a questioner, to feel that what I do has impact? And that might be, I suppose, in my personal life. Perhaps you've already just alluded to it, Dr. Cohen, behavior change. If we could take that as your answer, Indra, what would you say we could do as individuals?
I mean, basically the masks and social distancing and washing your hands are all basic hygiene. Just simple things, just to protect yourself and the people around you.
And as a business leader?
Lean in and ask yourself, what are the problems in my society and community? And how can I help with my supply chains, my distribution systems, the capabilities that I have? How can I lean in to retrain my workers as opposed to just firing them? I think businesses have to have a larger sense of humanity and a soul through these very difficult times.
Thank you both. That felt like a bit of a wacky race around an absolutely fascinating course, but certainly left a lot of food for thought in the room. And you could certainly let us know what your views are. And I'd certainly like to hear them too if you wanted to get in touch with us either via your channels and with me and my team at Economist Radio. Indra, Nooyi, Albert Ho, thank you very much indeed for joining us and your perspectives on a fascinating, worrying, but a fascinating time.